Ladies and gentlemen, I think I've had an opportunity to meet almost everybody here, but in case I haven't, I miss somebody. I'm Dan Ireland, I'm president of the United Memorial Medical Center, and it's my pleasure to welcome you all as our guests today as we review the state of the UMMC. I'm excited to tell you a little bit about 2015 and what we're going to look forward to in 2016 as I walk through a bit of some of the examples of things we've done, some of the growth that's happened, and really some of our commitments to high quality care in our community. Before I do that, though, I'd like to stop to recognize a few people. People who've been contributors to our success over the last few years and will be contributors to our success going forward. First of all, I'd like to take a moment and just ask with the folks who are putting this together for us, our foundation today, I'd like to recognize Lori and Roxanne for their hard work in helping pull this together and get us here today so we can talk about that. So thank you to Lori and Roxanne for that. Also, I'd like to recognize our foundation board. We have quite a few supporters from our foundation board. So if you're on our foundation board, why don't you just quickly stand up real quick just so we can, everybody can recognize the commitment that those folks make. Likewise, our hospital board, and we have members of our hospital board here today as well, and I'd like to thank our hospital board and ask them to stand up, folks from the hospital board that are here and help in a little bit, I'm going to talk a little bit about the volunteer commitment that we have in our community, but that volunteer commitment right there, those board members, they don't get paid a penny. And it's not one meeting a month, trust me, it's many meetings, it's many commitments, and we ask them to join and participate in a lot of activities around the hospital. And I'm grateful to the amount of commitment and support we get from our board members and giving up time in their personal lives to make sure that our hospital and our community has the health care that it needs. So again, thank you to all of our board members that have supported us over the past year and will continue to support us forward. Additionally, I'd like to recognize the members of my team that help make things work, flow, and happen at the hospital. And I'd like to recognize my senior leader team. So I ask my senior leaders who are in the back there, if you guys would stand up. If, we have Bob Shavetta, Kurt Coleman, Mike Merrill, Dr. Merrill, and Kristen Opet couldn't be here this morning, but they send their well wishes, and we'll be happy to meet them again at a different time. So before we go into what happened in 2015 and how we look at going forward, I'd like to kind of reflect a little bit on what we're doing. And I look at our vision and our mission, and really when we talk about our vision, we talk about where are we headed. So as Rochester Regional Health and United Memorial, as part of our 5-hospital system, as we look at our vision, really, you can't pick up a paper today or turn on a TV without talking about changing healthcare. Right? I mean, everybody's talking about it, whether you're in the political race and they're talking about it, or you're talking about the analysts and what's going to happen going forward, or changes in insurance company. And so we've looked at healthcare changes as an evolution, and it's an ongoing evolution, and it's not an instant thing. It will be happening now, it's been happening, and it will happen going forward. And one position that we have committed to is to be at the leading edge of that evolution, always looking one step forward and trying to anticipate what's going to happen next. And it's important for us to continue to do that, and it's important that our vision be that we are leading that evolution of healthcare. The outcome of that is a healthier, better community, and really that's what we're aiming for. We want our community to be as optimal as possible, as much access to healthcare as possible. We want to have the right kind of healthcare in the right places. So as we reflect on our vision, we really look at that leading that evolution and ending up with a healthier, better community. And each day when I talk to our team members at the hospital, I talk to them and I ask them, why do you come here? Why do you do what you do? So whether you're a nurse, or you're a housekeeper, or you work in our finance department, or you work in our patient billing area, I hear a very similar answer, and the answer really reflects in our mission, and it reflects in the concept that people are there to enhance lives, and we're there to really make a difference in the lives of our community. And we're doing that through integrating our healthcare, whether it's integrating within our system or integrating with our partners across physician offices, to hospitals in the Buffalo area or other hospitals around the Rochester region. But really it's that integrated delivery system that we're pulling together. Oftentimes when we say that, people think, oh, it's putting your computers together. Well, that's just one part about it. Information exchange is just one part of the integrated delivery system. It's also about making sure that we bring the right people to the community, that we provide care in the right location, and that we make sure that we are talking to each other about what's best for our patients. And one mantra that we always talk about is, how can we make sure that patients come back to our community? That is so important to us. That patients may need to leave the community for certain types of care, but how do we get them back in our community as quickly as possible? So their travel time and their healing time is optimized. And then really, the last part of our mission statement, the middle part's important, high quality, it's very important, and we're striving towards that, and we're seeing great results with that. The last part of our mission statement really resonates with what our team, they look to do their job with the kindness, integrity, and respect that every patient deserves. And I think no one can dispute that. When you come to the hospital, you look to be treated in a way that you would want to be treated everywhere with a high level of kindness and a level of respect. So it resonates with our team when I talk with new hires and when I talk with a team that's been there 40 years. The same message seems to come across. So that's our mission really does embody what we do every single day. Who are we? We're Rochester Regional Health. We're a year into our merger with the Rochester Regional Health System. The system is 5 hospitals, and just to kind of give you a little bit of a recap of where we've been and how we've gone over the last year. We've been pulling those 5 hospitals together to be an integrated delivery system. The hospitals, Rochester General, Newark Wayne, Clifton Springs, Unity, and ourselves. Plus, there's nursing home facilities, as well as home care and other support rehabilitation facilities that make up our network of hospitals. We are 16,400 team members strong. We have about 2,000 affiliated providers across the region, and our region spans from just east of Buffalo to just west of Syracuse. And anywhere you go that you see the Rochester Regional Health logo, you know that you're going to receive that same high quality of care that's embodied in our mission in each one of our facilities. And so we make that commitment to the folks east of us as they travel maybe to Darien Lake for a day, or come out to see the Jello factory, or are coming around our community. And that same commitment is given when we're down in the Finger Lakes, enjoying some of the beautiful weather we're about to have in the coming months. Last year, just to recap last year about where we've been with the numbers. Last year, we saw a very good, solid year. We had some great growth. I'm going to get to talk a little bit about that in a few minutes. But 635 deliveries in our maternity unit, growing and seeing more patients from diverse areas, including Wyoming County and more out of Orleans County and Genesee County. Over 5,000 admissions to our hospital for medical surgical care. And over 33,000 ED and urgent care visits. When people need their care immediately, when it can't be scheduled, when it's critical, we're there, our doors are open, and we're serving that population and really helping get them to the right level of care or taking care of them. A growing number, as I look at our urgent care numbers, they continue to grow. As I look at our ED numbers, they continue to sustain. So it is an area that we are there for our community as we go forward. A number I don't put on there is a 24% increase in our outpatient clinic visits. And part of that is because we've been able to open new access points and be partnered with new physicians to provide care in different parts of our region. But a growth in that outpatient clinic visit area has been key. 55,000 lives touched, individual lives crossed our threshold in 2015. 55,000, up 12% from the year prior, and really touching more lives through our community. So more access points, more places for care, meeting patients right where they need to be and right where they need care. As I look at how our payer mix is, it's been fairly steady over the years. We have seen a little bit of growth in our Medicaid population. I think a lot of it is some concerted efforts we've done to help make the uninsured tied in and enrolled in that. But our Medicare population is maintained pretty steady, and so is our commercial payer mix. So we are serving everyone, whether you have insurance or don't have insurance. We are there for you, and we are guiding people to get the most cost-effective care possible. When we look at how we ended up in 2015 financially, we had a good year. About $3.8 million in excess revenue over expenses. A very solid margin based on 10 years of strong work. As you can see, we've had a pretty solid performance over the 10 years, and it continues to grow. That $3.8 million is reinvested in our organization every year. We put that money back into the organization, into growth, into development, into making a difference in our community. Continue to provide the level of service that our patients expect for us. That equates to a margin of just a little bit less than 4% out there. Around New York State, the average margin is about 1%. For a lot of the community-based hospitals. So we're performing good, but I think any of you folks in the room, a 4% margin isn't what most businesses would strive for. You'd like something more than that. But in healthcare, it is a very respectable margin, and certainly something that we believe is a result of strong performance from our team and really good efforts that we've been putting in place to keep the hospital financially viable, to keep healthcare in this community going forward. I want to talk a little bit about in 2015 that we honored our volunteers, and every year we do give our volunteers recognition. But 85 volunteers in 2015 helped us out with almost 6 FTEs worth of time in various locations of our organization. So I pointed out our board members and the amount of commitment our board members make in volunteering their time, but also folks that work at our greeters' desks, that work in our surgical waiting room, folks that work in our gift shops and kiosks. They all volunteer their time to make a difference. I want to spotlight one volunteer that I think deserves some recognition. Every volunteer does a great job. But Colleen Smith. Colleen Smith came to our organization back in 2002 to start volunteering. She worked in the old snack shop. I think everybody remembers that. She worked in that area until it closed, and then she began working as a patient menu aide. And so what a patient menu aide is that as patients are making their choices for what they want in their meals for the next day, they go around and they answer questions and they help provide guidance and help get those menus so that they're turned in on time and meals are served appropriately to the patients. Colleen joined us because unfortunate loss of her daughter and her husband, and she felt a need to heal from that experience. And in that healing process, she was asked by somebody if she wanted to volunteer with the hospital, and she felt that may be a good way to do that. And so every year since then, she's come and she's worked and she sees our patients, but she just doesn't go in the room and collect the menus or answer questions. Colleen takes time to meet with patients. And she reflects on an experience where she had actually a patient who was just terribly scared. They were going to be transferred to another hospital. They didn't know what to expect. They were nervous. They were anxious. And she stopped and she sat with them. She held their hand and she listened to them. And she assured them that they were going to be okay. That the transfer was a good thing for them, and that she was going to, it was part of a process of care that was necessary. She spent time with that patient and gave them one-on-one care and allowed them to vent their feelings. She made a difference to that patient. And so as a volunteer, she didn't need to do that. She could have collected the menu and went and told another staff member. She could have, put it on a list of somebody to do, but she has that level of commitment, just like the rest of our volunteers that say, I'm here for the people that need me the most. And she's found that to be an incredibly healing experience for her as she's gone through her own life experiences. So we recognize Colleen. Colleen was spotlighted at Rochester Regional Health across the 5-hospital system this past year, and we were able to tell her story to many others, hopefully inspiring more volunteers to make a difference to the members of our community and the community across our region. So I'm thankful to Colleen, and we recognized her this year at our volunteer recognition dinner. All of this couldn't have happened, and some of the other accomplishments in 2015 I'm about to talk about could not have happened without your support. Whether it's time, talent, or financial support, each and every one of you in this room and your friends around the community have made a difference in making our community hospital truly a community hospital. And so I can't thank you enough for the difference that you make in what we're doing and some of the things I'm about to tell you. So as we wrapped up 2015, we wrapped up with some great accomplishments, and one of the biggest accomplishments that we were excited to do is on January 4th, 2016, we opened the Lips and Cancer Institute here at the hospital. A much-needed service in our community. We did a study of cancer care, and we realized that through that study that there was a population that was still leaving the community that could have been served locally here. And so with the backing resources of our folks at Rochester Regional Health, the expertise of their radiation oncology team and their medical oncology team, we were able to pull together a program that kicked off in April of last year. And that program development was bringing the oncology center and adding an addition to the hospital. On January 4th, we opened the center, and at the end of January, we cut the ribbon and did a great celebration. And folks, and many of you I saw there, were able to come in and see what the cancer center looked like. But what you don't see is what happens every day in that cancer center. What you don't see is the patients who used to drive 30 to 35 minutes to get a chemotherapy or to get a radiation treatment, and then bump and drive back on whatever expressway you're on or whatever side road to get home. You don't see that now they have a 5-minute drive back home. That they're back in their lazy boy on their couch, in their bed, back with their loved one in their house where they're comfortable, and going through the healing process and going through the treatment process that cancer requires people to go through. What you don't see is that happens every day, and you see the smiles on people's faces as they are relieved that they don't have to drive farther and that they can get their care close to home. The people who they know. Oftentimes the same nurses and the same providers that they interact with in the cancer center, they run into in the grocery store. There are people who just pass across all the time. And then when the unfortunate occurrence of cancer happens, they know that they can turn to those people, and those people will be there to help them. The expertise of our nurses and our providers, doctors like Dr. Wisa and Dr. Conley and Dr. Smith, our medical oncology team, or Dr. Haynes and Dr. Thomas, our radiation oncology team. Those physicians are guiding their path of care, hopefully getting them to the point at the end of their treatment where they can ring their bell of hope. The bell that was mounted and dedicated at our ceremony in January, that as each person finishes their course of treatment, they ring the bell and they move on to the next chapter of their life so that they can continue moving forward. I'm deeply touched by the level of service we can provide there in our community. I'm deeply touched by what I see with the patients and the care that is given from our cancer center. But without your support and without what you've done in the past years to be able to allow us to get to this point, we would have never been able to open a center like this, to add an addition that's dedicated just to cancer care. In the next month or two, we're going to be moving Genesee Cancer Assistance over to be right next to the Cancer Care Center, so that the community assistance support will be immediately located next to where the Cancer Center and the Lipson Institute is. Bringing, again, this whole connection that we have in the community, how we bring everything together so that patients get what they need, where services are offered right where they need to be offered. A few years ago, under Mark's leadership, we sat and talked about what do we need to do to make the next step. What are our investments that we need to make the next step to make sure our hospital is viable? And in that process, we determined that we needed a surgical center, and we needed to update our ORs. And I've told the story, and we've told the story, all of us, about how small it was and what it was before, and how we've made it really state-of-the-art. And the idea is that we built it, and now they're coming. So as we look at our surgical center this year, we've been able to add a number of new areas and new services to the surgical center area, into the surgical center so that we can provide good quality care. So we've added things like additional neurosurgery coverage in the area. And I recognize Dr. Pilcher's here. Dr. Pilcher's been in our community for a long time, and with the opening of the new surgical center, we worked with his group to offer opportunities that we can do there, as well as within Rochester Regional System. We have physicians, Dr. Reed and Dr. Petraga, that also are coming out in the community. So we're offering a variety of care in our surgical center as it's needed for the patients. With vascular surgery, we're offering vascular surgeons from Rochester General and Unity Hospital. Those vascular surgeons are here, a day a week in their offices, and they're able to do some procedures locally here in town. Again, avoiding the drive to Buffalo, Rochester as needed. And then general surgery, unfortunately back in November, Dr. Froy returned to his home state of Hawaii. Couldn't argue with him when he said he was going back to Hawaii, but he returned to his home state in Hawaii, and so we moved down a pathway to how do we replace Dr. Froy's presence in our community to ensure that we have good general surgery. And through a lot of work with Westside Surgical Associates, we were able to work on a commitment with them that they're now covering. So Dr. Griffith and Dr. Iannoli, Griffith, Iannoli, Rizzolo, and Maronian are here with us now on a rotating basis. So we have 4 surgeons who are covering the general surgery need in our community and making general surgery stronger. I'm really excited to announce today, and this is hot off the press within the last week and a half, we've signed a commitment letter with the new general surgeon who will be here full time, who will be working side by side with Dr. Zucchiotti in our surgical practice. So a young lady coming out of her fellowship will be starting in September and working. She went to residency with Dr. Zucchiotti, so they know each other well, and they know each other's skills and talents, and I think they're going to make a great team together as we go forward. So strengthening general surgery, and as I said, we built it, and now they're coming. And we have continued interest from other specialties talking to us about the future and how we can continue to offer services in our general surgery area in our new surgical center. In our ICU area last year, you heard me talk about the fact that we rolled out the telemedicine intensivist, and we were tied to the surgical ICU at Rochester General for telemedicine capability. That program has been growing and been successful in making sure that we keep higher acuity patients in our facility, and that we've been able to avoid some transfers and keep people locally here, which is always great for the patient and the family. Last year, we moved that program a little bit farther. We brought in a part-time intensivist. So we have Dr. Michael Schinleber, who's in our community. He comes out part-time now and sees patients and helps guide some of those patients in our hospital. A new level of expertise to help our hospitalist group, a new level of care that is provided. He helps determine where patients will end up, whether they need to be in the ICU or they don't, and he helps guide with clinical recommendations. In 2016, we'll be actually moving that presence to a full-time presence. There's enough need that 7 days a week we will have a presence of on-site intensivists doing rounding and making sure that those patients have the care that they need. Supported by the telemedicine group, we continue to have that connection with Rochester General and working through that. So a lot of growth in the quality of care of our organization, a lot of things we've been able to do between the Surgical Center and the Cancer Institute Intensivist program, really strengthening and broadening the care that we have locally. As we look back at the mission statement, the idea and the concept resonates when we talk about enabling access to a comprehensive network of care. We've had the fortune in 2015 to add some additional practices to our cadre of physicians. So in early 2015, we added a number of more stars on our map here. And as you look at that, we've added some practice locations in Warsaw, in Bergen. We've added a practice group out of Batavia, and because of that, we have a new site location in Perry that we've opened. So as I look at the map and I look at the number of locations and access points, let's reflect back on the fact that one of our strategic missions is to make sure that we meet the patients right where they need to be, and we provide early and easy access to get into the system of care that we provided for them. And so this map reflects the fact that we continue to grow that. The yellow stars are other areas that we're under consideration right now and other efforts that are working to provide access points. So stay tuned for those, and we'll continue to give you more insight. But let me tell you about in 2015 what we did have. In early 2015, we added Genesee Orthopedics and Sports Medicine. Through a collaborative effort with Drs. Lanfried, Hoy, and Otten, we were able to bring that practice into our fold. Part of that bringing them into the fold was our ability to continue to sustain orthopedics in our community, to continue to grow and sustain the access to healthcare in the long term. That did add our opportunity to add the Perry location. Additionally, we opened services in Medina. Orthopedics now goes out to Medina and sees patients in the Medina practice as well. So we're spanning 3 counties of orthopedic support and coverage and making sure that patients do get the care where they need to get that. Additionally, as the year progressed in September, we opened a clinic in Bergen and tied with Dr. Majuli. Dr. Majuli approached us and we talked about what the future of healthcare is in the northeast quadrant of our community. And Dr. Majuli was very passionate about the fact that he wanted healthcare to remain in that environment. He had invested 30 years into it, and he wanted to know how we can work together to make that happen. So through a collaborative effort with Dr. Majuli, we were able to work with the Gillen Gray Community Center, and we renovated and invested $1 million into a building out there that will sustain healthcare there for at least the next 20 years, if not beyond. And we opened the practice back up. After 10 years of being closed, Dr. Majuli not accepting new patients, we were able to open that practice back up to new patients. Invested in nurse practitioner, Katie System, who is actually a local member of the community, grew up in the Byron, Bergen area, and is now a provider in that practice as a nurse practitioner. So we've been able to make a difference in that community, sustain healthcare in that location. And then in November, through some collaborative efforts with Dr. Scott Traitline, we were able to work on a relationship with his practice in the Warsaw area. Dr. Traitline was at the time the only provider of OBGYN services in the Wyoming County area and was basically flying solo. That meant 365 days a year he was on call. He was always there. He had to deliver patients, and he didn't have any relief unless they brought a local physician in. Dr. Traitline recognized that that's not a sustainable model. I don't think for any of us that would be a sustainable model. And we talked and collaborated when he came to us and said, what can we do differently? So we brought him into the practice fold to add with our current women's care services. And at the end, in November, we all connected together, and we have now OBGYN services, women's health services in Medina, Batavia, and Warsaw, spanning the 3-county region. Allowing those patients to return to our newly renovated maternity unit to receive their care to deliver their babies. The experience has been very positive. Shortly after that happened, I went up and visited a number of patients, and I was able to talk to them and say, how are things? How did you enjoy your care? They were all resonating with how wonderful their care was, the staff was, the facility. All the investments we've made really were paying off and providing a great environment for them to have their babies. And then our belief is hopefully return for more down the road would be the goal. So now, again, comprehensive model. And if you don't see the theme here, the theme is we want to really make sure that wherever specialty services or primary care, we want to make sure we're offering those access points for those patients where they live and giving them high quality care where we are. So a lot of investment in 2015, more to come as you saw the yellow stars in 2016 with more ideas and more locations where we can continue to meet patients along the way and really keep a good outlook. Through all this, we don't aim to get recognition. We honestly don't. Our staff just goes to work and they do follow their mission and do their job every single day. But recognition has come, and in 2015, they earned it. In early 2015, the Buffalo News put out a survey and said, rate your employer. The management team had nothing to do with it. We're not allowed to be interactive with it. The team members of the organization voted, and our team members voted us one of the top workplaces in Western New York for 2015. A great place to work. They resonated with comments like a family environment, a fair working environment, a good place to call home. And so we're very honored to receive that award, and very honored that our team members, thought so highly of us and continue to think so highly of us. And then to an additional surprise, in late summer, early fall, we got a call from Press Ganey Associates. Press Ganey measures patient satisfaction, and they do a lot of the regulatory online survey, or not online, but mailed surveys for patient experience and patient satisfaction. And they called us and said, we want to let you know that we're recognizing United Memorial for continued growing excellence and continued improvement in patient experience. And over a 2-year trend, they have been monitoring us and saw that our patient experience scores had grown steadily. 10 points over 2 years in the growth of our experience scores. And in that market and in the healthcare region, to move experience scores 10 points is actually a monumental feat. 1 or 2 points is really what's expected in a year's worth of time, and we did it over 2 years, over 10 points. So in November, we were able to go to the national conference and receive recognition amongst a number of other hospitals, but as a continuous improvement through Press Ganey. So again, our team earned that. They worked hard for that. They didn't know they were working for it. They were just doing their job every single day, and it was good for them to be able to get the recognition that they deserved for the hard work that they did. As we wrapped up 2015, one of the last things that I want to talk about, when we talk about 2016, that we did was we reconnected our commitment to patient experience and patient satisfaction. We recognize through evidence-based medicine, we recognize through the industry, that it's being seen now that patient safety and patient experience really go hand in hand. And so you can't have one without the other. So I may be able to give you a good quality of care, but if I'm terrible to you and I treat you badly, then you actually don't get the quality of care that you should be getting. But if I treat you well and I make you have a good experience and I give you good quality care, that is the optimum model. So in late 2015, we started taking steps to make sure that we were providing the safest environment that we possibly could provide. And in November, we rolled out something called Daily Safety Check. Every single day, 365 days a year, we meet in our boardroom at 10:45 in the morning. And the goal of that meeting is every department comes to that meeting and we talk about safety risks in our organization. It's always led by a member of the senior leader team. There's always more than one senior leader present at those meetings. And the management team or team members from each of the departments report on it. And sometimes it's simply just saying, I'm from 3rd floor, I'm Dan Ireland, and we're safe. But other times it's, I have a risk. We had maybe a potential fall. Maybe there was a patient who was acting out or a visitor who was acting out, and they talk about it amongst the group. And so everyone knows about it. It's helped us stem situations where unfortunately we've had some people coming into our hospital who haven't behaved properly, and we've had to address that. It's helped alert everybody of that risk. You know, as we talk about, and again, you can't open a paper now today without some type of violence happening in workplaces across the country. It's helped recognize that in areas like hospitals that are most vulnerable, how do we manage those risks and how do we let everybody know about that? And every department goes through it, and then we do the same thing with a look forward. And a great example of how this happens is in our Cancer and Infusion Center. I've actually been impressed about the fact that we offer some cutting-edge medications, recently FDA approved. They're the cutting-edge therapies for some of the cancer care, and we're offering those hot off the press to some of our patients. The risk with doing that is that you don't know always how patients are going to react to that. A new medication for a new patient, everybody reacts a little bit differently. So in our daily safety check, you'll often hear our nursing staff from the Cancer Infusion Center saying, we're giving a new medication to this patient today. What that does is it puts everybody else on alert, that if there's an issue, it could be that medication and how to respond to it so that we're providing immediate and prompt care to those patients that might need it. Thankfully, we haven't not had too many of those situations. The meds we've been giving, the patients have been tolerating well, but we're on alert and we're ready. And I think that's part of what we look for in our daily safety check process. It's been very successful in helping us address issues with patients, with families, with caregivers, facilitate transfers, facilitate keeping people local in the hospital, and keeping our staff, our patients and visitors safer. So what we did in early 2016 during National Patient Safety Week is we said to our team members, we'd like you to renew your commitment to patient safety and make this pledge. And this pledge, which is announced every day at the daily safety check, is that we are creating a world where patients and those who care for them are free from harm. And our over 375 team members signed that pledge. And what you can see if you come to our hospital is if you walk down by the cafeteria, you'll see this poster, but it's full of names. And we gave everybody who signed the pledge a magic marker and said, make a public statement about it. Some larger than others, as you will see in some of them. Some people are very passionate about their safety commitment. But I encourage you to take a walk down by our cafeteria and look at that. Or if you're at one of our Jerome Center locations, they're on the wall there as well. The people who work in each of their locations sign the pledge for their location. But it is our commitment, it is a strong commitment from our folks that we're going to maintain the safest possible high-quality environment for our patients. So with 2015 wrapping up, we couldn't stop there though. We have great performance, we have a great outlook, we've got a great vision. And so part of what we're looking at is what are we going to be doing going forward and how do we push forward. And so I want to outline just a couple of key projects that we have coming up, some things that you can look forward to, and hopefully some things that you can participate in with us as we go forward. So I'll wrap up my talk today with a few of these. The kickoff in 2016 is really reinventing and focusing everybody on the fact that the patient is at the center of what we're doing. So this model that we use and we've shared with our team members and throughout the organization really does demonstrate the patient at the center with high team engagement, high patient satisfaction, and high quality to the core of that, supported by our financial responsibility, our growth, and our community investment. So really I think this really displays the model of how we want to make sure going forward that we keep the patient front and center as we make changes, as we do growth initiatives, and what we're looking forward to. We're talking about a $26 million investment. 5 major projects coming up ahead of us, plus the cancer center that we just finished. 5 years, but really it will set up for a lifetime of healthcare in Genesee County. And I think that's very important as we look forward to some of these projects. First on the docket is the radiology renovation project. Our MRI that we have today, you probably recognize it, it's in the trailer. That MRI is going to be due for a replacement in the coming years. And so teeing up, looking forward to that replacement, we're looking at how we're going to handle that. We will not be in the trailer after that new MRI comes in, but we're looking at an MRI in the facility. To orient you to the drawing real quick, I know in the back it might be a little bit hard to see, but at the bottom of the screen here, this is the bottom of the gallery aisle, the ramp. All right, so right at the bottom there, and our idea and concept is that opening at the bottom of the ramp will take you right into the radiology lab draw center. So patients needing radiology and lab services and other diagnostics can go directly into that area right off the registration lane and not have to traverse the hospital to get there. This model helps to design to keep inpatients and outpatients paths from crossing each other as much as possible, which is healthier and safer for everyone involved. It forecasts new equipment purchases related to nuclear medicine, radiology, fluoroscopy, and regular diagnostic X-ray as we build into it. And it sets up the infrastructure for the next project, which will be our ICU renovation project. It additionally reestablishes a corridor along the way here that will take off of Summit Street back into the main hospital and having that corridor. We recognize when we built the cancer center that it was a bit inconvenient for those who were used to parking at Summit Street and getting into the ground floor of the hospital. This will reestablish that connection once this project is done. After this project, we look at our ICU renovation. We call it the last frontier. We give great quality of care in our ICU. I can support it by the data, I can support it by what patients say for us, but if you walk through the environment, you know that the environment needs to be updated. Standard of ICU care going forward is private rooms and private bathrooms in each of those rooms. Today we still have some semi-private rooms in our ICU, and it's been creating an inefficient model. So we're designing and developing an 8 to 10 bed ICU area. It's going to have what some of the new designs of any new build is that we have a center nurses station and all the rooms follow around the outside of it, so that way nurses can keep eyes on patients at all times. It will have workstations along the rooms as well, so nurses can work close to the bedside as they need to do that for the more intensive patients that are occurring. We're looking at a dedicated area where pediatrics patients will have a more pediatric-friendly environment. Today we do house our pediatric patients in our ICU because of a lower volume and the need to continue to have that service in our community. Additionally, we're looking at other expanded services, things like enhanced telemedicine. How can we bring other specialists into the fold besides the intensivists? Things like dialysis and other things that we don't offer acutely in our community. We're exploring those options and the potential of adding that to our ICU fold as we go forward. The actual location of this is proposed is on the second floor, but on the opposite side of our ICUs today, and it actually bumps out over top of the new radiology expansion. So the physical building will grow a little bit on the upper floors. And if you're standing in front of our cancer center and you look up to the right, you'll actually see the beginnings of that. When we constructed the cancer center, we designed it ready for this. When the radiology project comes into place, it will finish that design and allow for us to build going forward. Again, we're always trying to take that one step in that evolution. What would be next? And ICU care will be something that we need to have. Even as we move to the model where more outpatient work is happening, there still is a need for some intensive care and high quality intensive care. And this will set up the model for us to do that. Once the ICU is done, one of the things that we lack in our community is good palliative care support. We have a need for additional hospice type beds. We have a need for places for patients who are going through that transition life to go. We want to take our old intensive care suite and renovate it and turn it into a palliative care unit. We already have a palliative care team led by Dr. Robert and a number of key team members, including our chaplain service and a number of nursing team members who have invested their time and energy in becoming experts in the palliative care world. But what we need now for them is a place for those patients to go that are not the typical hospital room. If any of you have been in any of the hospice facilities in Buffalo and Rochester, you know that when you walk in there, it's a very comforting environment. It's a very easy and calming environment. You don't hear overhead pages and bells and whistles and all that thing going on. What you do is you have a peaceful environment for people to spend time with their loved ones during the transition of their life. And so what we aim to do here is put in a palliative care unit on that side. 4 to 6 beds is really what the intended need looks like, and those patients would be able to receive that care right in our facility. So as they transition and it's identified that they need that type of service, they would move from an acute hospital bed into the palliative care unit, and the family would have all the support that they needed from our dedicated team. So very encouraged by this, and I think it's an important part of the continuum of care that we look to work towards. You know, primary care, as you saw the stars, a lot of those practices are primary care practices. we need to make an investment in the next 5 years into what primary care will look like going forward in our facility, in the city of Batavia and in Genesee County. So we're naming a project here that will right-size primary care with the right number of beds, supported by our residency program. We continue to have our residency program. I think last year you heard us talk about that. We'll be having 12 residents for family medicine. We're up to 8 now, and we anticipate having 12. As a matter of fact, update on that, 9. We have one more join us for next year, so we'll be moving forward, gaining more family medicine residents, and it'll be done through this primary care center. But it'll offer other services, working on integrating with mental health and acute care services, and how we can provide crisis intervention and tying that together. Working with dental and how we can provide some dental services and things along that line. Things that we have gaps in our community. Right now it's targeted for the Jerome Center area, somewhere in the Jerome Center, right? First floor seems to be the idea, but we're still working with the architects and some of our other projects to see how this fits best. And then lastly on our 5 project list is a teaching center. And you can't do all of this and sustain your team without a good place to teach them, without adequate facilities to make sure that they can receive the education that they need. So we're looking at where on North Street we can position this, but North Street is the right location for it because the majority of our team works at North Street, and we have teaching facilities at some of our other sites. But this would be up to a 75-person teaching area with breakout rooms for simulation labs and computer labs. And right now we're trying to work with the architects to figure out where that fits and how we make that happen. But it's one of the goals that if we ignore it, we're not going to be able to continue to sustain the growth and development of our team as we go forward. So 5 projects, 5 years, a significant investment, and hopefully a lifetime of healthcare in our community. Before I wrap up, before I close today, I want to share one last experience with you. This is our wound care team, members of our wound care team, led by nurses, hyperbaric technicians, and physicians. Back at the end of March, they encountered a patient, an older gentleman living down in Wyoming County. It was identified that he had a wound and he needed some care. After an assessment, they decided that the best care for him would be to have hyperbaric treatments. And while his care was paid for through Medicare, and all of that would be covered, he wouldn't have to have any out-of-pocket expense for that. His challenge was how to get here. How do you get from his house to the wound care center? And if you know anything about hyperbarics, and what you should know is that when you're having hyperbarics, sometimes it's a number of days in a row for a period of time. So it's not just once a week or once every other day. Sometimes it's multiple days in a row during the intensive phase. The gentleman started to understand what his needs were going to be, and he said, I don't think I can do it. I don't have any family in the area. I don't have any way to get there. I'll take my chances, and I'll go without it. This team didn't accept that. They didn't think that was right, and so they started calling around. They called our case management team. They called the Department of Social Services, and so they said, what can we do for this gentleman? And through a bit of work and a bit of effort, they were able to secure a Medicare transportation service that would make sure he got to his appointments, and he was able to get that care. And anybody with some of these wounds, especially in our older population, if you don't take good care of them, it progresses and it gets worse. Oftentimes you can lose a limb from it, and oftentimes it can be a very bad outcome. So getting him to his HBO hyperbaric appointments was key for this person's longevity and making sure he was going forward. I'd like to tell you that that's where the story ends. We're all thumbs up and everyone's happy we made a difference for this person. But that's not where it ends. One day, after this had started, he called and said, I wasn't able to get my pre-work done for my next appointment, lab work and diagnostic testing. I'm going to cancel my appointment. Again, the staff said, wait a minute, we can be flexible here. Why don't you come to the hospital anyways? We'll work out getting your pre-work done while you're here, and we'll get you in for a later appointment. And so they worked their schedule around, and he reluctantly said, okay, I'm not feeling that great, but I'll come. When he got to our facility, the staff recognized immediately that he was running a high fever, and he did not look well at all. They encouraged him to go down to the emergency room. He said, no, I can't do that. I've got to get back home. I don't want to go to the emergency room. Shortly into his stay, though, he collapsed. The team responded by calling a rapid response. It's a code in our facility that brings medical specialists to the aid of a patient and brings all different people in to see what we can do to help that patient. Our hospitalist PA, Lisa Fillions, came down, assessed the patient with the team from the wound care center. And they immediately identified that this person was in a very bad way and that he was needed to go to the emergency room. He reluctantly agreed at that point to go to the emergency room and was admitted to the hospital that night. All providers caring for him agreed with one conclusion. Had he not come to the hospital that day and been cared for, he was so septic, sick with an infection, so septic, he would have died that night in his house, alone. Because this team wouldn't accept no as an answer. Because this team made sure that they looked for every outlet to make patients better and to care for them. They gave this patient another chance. Today, he continues his therapy and his healing process. He was discharged from the hospital a short time after that, and he continues to come back and live well in our community. It's people like this every day around our hospital. It's people like our wound care team, our emergency team, our therapists, our nurses. They don't accept no for an answer. They become flexible. They make a difference for those patients. It's about that experience. That's what a commitment to zero harm is. That's what making sure our community has all the help that they need really looks like when it comes to healthcare in our community and across our region. So we're creating a world where those patients are free from harm. I'm happy to take any questions that you might have, any ideas or thoughts that you might have. And I thank you for your time today and being here and hearing about how we're doing. Thank you. Any questions that anyone has? Or are you all high at the golf course? Thanks for your day. Enjoy your weekend. Be well, be safe, and look forward to seeing you again in the coming year. Thank you.